A damning report came out from Ontario's Auditor General that gave a scathing indictment on how that province has handled the COVID crisis in long-term care homes. And it explained why at least 3,756 residents and 11 staff, just those are staggering numbers, died in long-term care home facilities. The report concluded that the Ontario government and the long-term care home industry were not prepared for the pandemic. There was a lack of infection control measures in place. There was staffing shortages. There were overcrowding issues, lack of inspections, lack of PPE. Look, this is not even the first damning report about the state of long-term care homes in Ontario. The military released an eye-opening report last May at the start of the pandemic. But today, the long-term care minister, Mary Lee Fullerton in Ontario, had this response to this report. Look at this.
We were a standalone ministry created to focus on long-term care, following the commitment by our government to build 15,000 beds in 5 years and create capacity that had been so sorely neglected. So the responsibility, it's kind of like running into a burning building. You know, you're trying to save it and you're doing your very best, but the fire had started well beyond the pandemic.
Okay. Is that the accountability? You decide again. We asked for the minister to appear. She declined. But what happened to the province's promised iron ring around long-term care homes? Again, we did ask the minister. She's not available, but the author of the report is. Joining me now is Ontario's Auditor General Bonnie Lysyk, author of today's special report on long-term care home in that province. First of all, Auditor General, always a pleasure to have you on the program. I'll read one damning sentence here. Neither the Minister of Long-Term Care nor the long-term care sector was sufficiently positioned, prepared, or equipped to respond to the COVID-19 issue. Can you tell us what were your key findings in terms of how badly prepared they were and the gaps you found?
Yeah, so it was the Ministry of Long-Term Care and the long-term care home sector itself. I think, there's maybe three areas. One of the key ones is that in terms of the past reports that were written from our office, but also from the SARS Commission, the SARS expert panel, there were a number of recommendations there in terms of infection prevention and control that weren't implemented, and therefore, again, the non-implementation contributed to the sector not being positioned, prepared, or equipped to respond to the issues created by the pandemic in an expedient and effective way. I think we've also known that the sector itself has had a lot of systemic issues. And so the COVID situation just exacerbated some of the problems in that, in terms of, number of people that are occupying rooms, in terms of, the PPP inventory. There's a number of areas. And I think as well, the sector was going through restructuring. And when you look at the health system in Ontario, the long-term care sector has kind of been like a second cousin. It's been outside by itself operating. We've recommended in the report that there be more integration of the sector in terms of working with the hospitals, working with the public health sector group. Also integrating it into consideration of whether or not you need beds in the long-term care sector, you need more home care, whether you need retirement homes, assisted living, so that integrated picture. So they weren't ready, mainly though because of the lack of implementation of some of the IPAC infection prevention control measures, as well as the history of systemic issues in the long-term care system.
I'll just go over them. You say number of people per rooms. There had been a recommendation years earlier that there should be one person per room. There was 3 to 4 people per room. Obviously a petri dish to spread, which contributed to the death of 3,756 patients and 11 staff members there. Lack of PPE that you talk about, Bonnie Lysyk. But one of the things you highlight is that the current government, the Ford government, canceled the thorough and surprise comprehensive inspections in 2018. How did that contribute to the vulnerability of these long-term care homes?
Yeah, that was kind of the impetus for our audit as well. Way back, we had looked at the inspection process in the ministry in around 2015, and at that point, they were doing comprehensive inspections. There were a lot of complaints and incidences that weren't being looked at. We recommended they consider those in the continuation of comprehensive inspections. They then created another inspection category, which was less fulsome than the comprehensive. And then in the fall of 2018, it was the ministry, the civil service made a decision that instead of doing the comprehensive inspections, they would catch up on the backlog of complaints and incidences. I think there were outstanding ones of about 3,000. So in that sense, they then did that instead of continuing and doing comprehensive inspections. So really, both are important, but the comprehensive inspections were the type of inspections that would have pointed out weaknesses in the infection prevention and control area.
You point out that the Minister of Long-Term Care and that whole ministry they lacked oversight. What do you mean?
I think what we're saying is that the ministry, in terms of the inspection process and really not knowing the homes as well as you think they should know them from the inspection side of things, that's where you need the oversight. You need to make sure that the management in those homes is doing what they're required to do under law, but check on that and also follow through on the inspections. There were many times inspections were done over the years where there were lots of compliance orders issued for the homes to fix up their act, and they had many chances. And so we have recommended that be looked at as well, that at some point you have to think about fines, enforcement, to make sure that the serious issues that come up through these inspections are dealt with timely and effectively.
I mean, that's the one thing. These are licensed places. If you don't license them, they can still function without a license, but you were talking about maybe bigger fines. 13 of the worst hit 15 homes, the highest number of resident deaths, were for-profit institutions. There's been calls, the NDP have called for the end of for-profit long-term care homes. Is that the solution, that it's the for-profit model, or what did you find about the for-profit institutions that led to so much death in those institutions and so much damage?
Yeah, I think there's a number of issues. I mean, I don't know if it's as simple as just for-profit, not-for-profit. Having said that, the data does show that the for-profit homes experienced higher incidences of COVID. I think what's needed is more relationships between the public health units and the hospitals and all long-term care homes, whether they're private or not-for-profit. And also we did find, though, in the for-profit side, that the for-profit sector has the most facilities that accommodate 3 or 4 beds. So there is a need for more modernization in the room capacity for people. So instead of having 3 or 4, the rooms need to be changed to 1 and 2, which are really what the 1999 standards that were put out by the ministry indicated should be the case. But it's been 20 years and those rooms are still there.
Once the crisis hit, the Premier of Ontario said he's going to put, quote, an iron ring around long-term care homes. Your report kind of says the iron ring was a fiction. What do you make of that? Was there an iron ring?
I think the long-term care homes, there were directives put to the long-term care homes from the Chief Medical Officer of Health, but the long-term care homes had to figure out how to implement those things in those directives in their home by themselves. So I would say at the beginning of the pandemic, they were operating, quite independently, though reaching out for assistance. They did experience the PSW situation, lack of staffing, and that sort of again exacerbated the situation. So. You have to be fair about it. I guess the pandemic was new to everybody. Having said that, we do think if the systems had been fixed years ago, that the long-term care sector wouldn't have experienced what it did.
Now, there is a Minister of Long-Term Care, Marilee Fullerton. By the way, we asked her to come on the show. She declined our request. I know she held a news conference. She did blame previous governments, the bureaucracy, community spread for the crisis. It was under her watch. As the Premier of that province says, the buck stops there. So the buck starts with her. What does she need to do right now?
I had a fairly robust meeting with her on this draft report, and I do believe that she is sincerely intending to make changes to the long-term care sector. I think what we had happening too is a restructuring with a new ministry being formed separate from the Ministry of Health There was a new Deputy Minister of Long-Term Care, a new ADM of Long-Term Care, just as the pandemic was hitting. So I think they need more stability in the staffing in the Ministry of Long-Term Care with experienced people. I think they need to deal with the issues that are highlighted in this report, as well as the issues that will be highlighted, I would anticipate in the Long-Term Care Commission's report, and just go about implementing them. They have started. I mean, there are initiatives that we did see being put into place in the last few months, and continuing with them is great, and improving the sector more, as well as thinking of long-term care as part of an integrated part of the healthcare system.
Right.
And I think that is something that the minister is thinking about.
Well, we'll find out what changes actually happen. And Bonnie Lysyk, Auditor General of Ontario, on that new report. Thank you so much. Appreciate it.
Okay. Thank you very much.